Hello everyone. This presentation is on Qing Tang, also called minor blue-green dragon decoction. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Qing Tang belongs to the category release the exterior. A representative pattern is exterior cold with interior thin fluids causing cough, wheeze, and copious frothy sputum. Important ingredients include ma huang, gui zhai, gan jiang, zai zin, ban zia, wu wai zai, bai xiao, gan kao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 52-year-old man with chronic bronchitic wheeze triggered by cold weather. The current medicines are albuterol inhaler, lisinopril, hydrochlorothiazide. This case gives a possible reason to consider Qing Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is ma huang plus albuterol. The mechanism is that both may increase heart rate, tremor, and blood pressure. The clinical significance is moderate to high, especially in anxious patients or those with cardiovascular disease. My management plan is avoid uncontrolled hypertension and monitor for palpitations or insomnia. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is gan kao plus hydrochlorothiazide. The mechanism is that licorice may worsen hypokalemia and blood pressure control. The clinical significance is moderate. My management plan is monitor blood pressure and potassium, avoid long courses without follow-up. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Wu Wai Zai plus CYP metabolized drugs. The mechanism is that Schisandra can affect CYP enzymes and transporters, potentially altering drug exposure. The clinical significance is uncertain but relevant for narrow therapeutic index medicines. My management plan is obtain pharmacist review if the patient uses critical prescription drugs. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Qing Tang may be reasonable when the patient truly matches the pattern exterior cold with interior thin fluids causing cough, wheeze, and copious frothy sputum. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.